I spent some time in a rural spot in northeastern Pennsylvania. I was there for 5 years after I got out of my residency. It was a little town called Honesdale. It was about 40 miles outside of Scranton. And I'd been there for about 2 years when a trans woman came in. My patient's story was that she'd been to 3 endocrinologists in the Scranton area and been refused. All 3 had declined to see her and to help her manage her hormonal treatment. This patient found me because 45 minutes away she'd heard there was some LGBT clinician in the area, and we're talking across 3 counties.
So it's important to be trained in LGBT healthcare for numerous reasons. Historically, and we're aware now that LGBT individuals have received poorer care than their non-LGBT peers.
The patient really is at the center of everything we do here, and we want to provide the best care possible. And I think providing the best care possible means being culturally competent to do so.
Recently, within the last year, I had a pediatric patient who identified as a transgendered woman, and a lot of the people on my medical team had no idea what to do with the patient. They just kind of wanted to work through the symptoms of the patient but not really look at the patient as a whole, and not necessarily because they had a problem with the patient being a transgendered woman, but because they didn't understand some of the issues surrounding being a transgendered patient. And so being able to discuss that with my patient and find out what my patient would like to be called and how my patient would like to be identified, and being able to have that one-on-one conversation with my patient was really important, because I felt like I had a relationship with the patient and I was able to relay really important medical information to the rest of my team.
For many, many years, LGBT people have relied on LGBT identified healthcare providers or settings, wonderful programs that kind of filled the gaps, but they were oversubscribed, they were underfunded, and they weren't available to everyone. You had to be in a major city, you had to be near a federally qualified health center, and now with more and more people coming out and being out, LGBT accessible and competent care across this country, everywhere, is really, really important. And that means our mainstream institutions have to come up to speed. So that's really where we need to go. We need to make sure that our mainstream institutions don't just have policies and procedures and good intentions, but they know how to put those good intentions into practice.
I think it's important to come out for a number of reasons. And this is true for many populations that are underrepresented in medicine, including LGBT populations, women, racial ethnic minorities, is that as you come out and you progress through academic medicine and careers, you end up serving as a role model and a marker for the next generation.
I felt like the benefit was being able to answer any question completely honestly. I could just be authentic.
The education aspect of medicine and clinical practice is very, very important. It's something we try to focus on as well, that by being out, you're helping to educate, you're helping perhaps in ways that you probably don't know to counter stereotypes or impressions that people have. And so that's why it's so vitally important.
Realize that you're not doing it just for yourself. You're doing it for your fiance at home, for your children in the future, for your friends who are living in places where it's really dangerous for them to come out. If you can come out, I think you should. And I do it because it's just the truth. It makes me feel comfortable. And also, it's a little bit of advocacy.
I feel like I've been very blessed and lucky. Where growing up, my parents felt it was very important for myself and my brother, we're both gay and we're both physicians, to be confident. I've always felt very lucky to have that support network at home. And having that support network at home also not only gave me the courage, but also built in me the expectation that I should always be treated with respect and that I can be out in any setting.
Being a successful physician or scientist it always involves an element of risk. And I think people should be who they are and accepted for who they are. We need to really foster a culture here where there is no risk for a student to come out and say, I am this or I am that.
I would say call to action to all LGBT clinicians who may not find themselves in San Francisco, New York City, Detroit, Miami, and other places where they may have a thriving culture and LGBT other clinicians to sort of network with immediately available. You won't even know your value until you come out as a clinician in those places.